While everyone around us is talking about this little gadget here, let's not forget the power of analog dentistry that we've been using for so many years in the past. Even though today intraoral scanners are hogging on the limelight, there is a big number of dentists in India who use the physical impression workflow and also encounter some problems associated with this process. So if you use addition silicone impression materials, this video is meant for you. First things first, let's talk about this very important consideration. Now I've seen a lot of dentists mixing the putty with gloves and a few of them prefer not to use the gloves as well. So if you're amongst the former group, it's very important to note that we never use latex gloves while mixing and manipulating the putty. This can retard setting and in fact even inhibit setting completely. Instead of the latex gloves, you can use latex-free vinyl or nitrile gloves if you have them. One of the keys to precise impressions lies in the mixing technique. We never want to rush through this step. A lot of us try to rush through the putty mixing and we forget to mix it uniformly. The goal is to achieve a smooth, homogeneous mix until you see a uniform color without any streaks. If you end up seeing streaks like these, the putty is not mixed correctly and you will not get an accurate impression. Inside the putty box, you have these two color-coded scoops. This one is for the base and the other one is for the catalyst. Always use the dedicated scoops and don't interchange these so as to maintain the properties and setting characteristics of the material. Now we all know that bleeding is detrimental to the success of the impression making process. But not all bleeding is bad. What I want to say is every time you mix the light body or any other syringe based material, bleed it before you attach the mixing tip. This ensures that if there is any air entrapped in these barrels, it is vented out and you get uniform proportions of the base and the catalyst. After this, put on the mixing tip and the intraoral tip, bleed it again like this and then dispense the material inside the mouth. This will ensure smooth, even mixing to give optimum results and perfect surface detail. This, in my opinion, is the most underrated aspect of impression making. We never read this little piece of paper inside the box that can give you some really important information in terms of mixing ratios, mixing time and setting time. This especially applies when you use any material for the first time or you get a super bulk deal for a new impression material at a conference. Always go through the instruction sheet because this can really make all the difference. To achieve stellar impressions, selecting the correct technique is vital. Consider whether a one-step or a two-step protocol suits your case best. Also take into account the type of tray and impression material that aligns perfectly with your specific needs. These simple tips and tricks will help you make immaculate physical impressions every single time. Don't forget to like this video, share it with your friends and colleagues, and keep watching for more.